and limited diagnostic capacity. If we are to protect our citizens from future threats, KNPHI must become the engine of transformation, driving a culture of prevention, preparedness, and evidence-based response. As you are aware, counties are the first line of defense in disease surveillance, outbreak management, and public health intelligence. I think this is extremely very fundamental. The success of KNPHI will depend on the strength of county-led systems for early detection, timely reporting, and rapid action. We must invest deliberately to the subnational level to ensure no county is left behind. And that's why we had a brief talk with the CS, and we agreed that this critical component that is called the Council of Governors, representing the 47 counties, should be included and considered to be among the board. To further enhance our national preparedness and response capacity, we call for the establishment of well-resourced regional infection disease centers anchored within counties and linked to the Kenya National Public Health Institute. These hubs will decentralize disease intelligence systems, facilitate a real-time data sharing, and enable rapid, context-specific responses to public health threats. We urge KNPHI to prioritize coordinated, timely, and accurate data sharing with counties, and to support the use of this data for evidence-based planning and decision-making. Joint planning and implementation of public health programs, including training of health workforce, should be central to KNPH operations. The institutes must also ensure that counties are adequately equipped for responsive outbreak management and supported in translating research and emerging evidence into effective local health interventions. To realize the full potential of these initiatives, strong county and national collaboration must be institutionalized. The success of KNPHI hinges on how well we integrate the devolved system of governance. As I conclude, I call on all stakeholders, national government, development partners, and the private sector to work in close partnership with counties to power this institute. Let us embed a strong culture of county engagement and shared responsibility at the very heart of KNPHI operations. As a Council of Governors, we reaffirm our commitment to working very closely with the KNPHI and the Ministry of Health as we've done before. We look forward to a collaborative relationship built on mutual accountability, shared data, and joint implementation of public health interventions. Let us seize this opportunity and build a resilient, inclusive, and responsive public health system that delivers for all the countries in this country. Thank you very much, and may God bless us all.
Thank you so much, Madam CEO. Waziri, you know, you have instructed us to make sure that between ourselves in the ministry and the Council of Governors, we are one team. And so even when Mary insists on reading a speech, Waziri, you know it's again your directive, so there's very little I can do. So, but thank you so much. Waziri, 2 weeks ago, you met with the Director General of Africa CDC, Mr. Jean Kasea, and we are very privileged that he has sent a representative in this your meeting. I would just like him to stand and wave. Of the Africa CDC. Thank you so much. We have a representative from the Africa CDC following your meeting, sir, with the Director General of the Africa CDC. At this juncture, Waziri, I would like to invite the pediatrician. Yes, I am also made aware that we have also representative from the United States CDC also in our midst. Please, can we give a round of applause as they stand to wave? Oh, thank you so much. Oh, yes, yes. Oh, hi. I mean, yeah, I could see you from afar. Thank you so much for the support and the collaborations. Waziri, at this juncture, I would like to invite the real pediatrician, but who now is not a pediatrician anymore, but for purposes of today, he should restrict himself to being a pediatrician so that he can nurture this baby, both in terms of resources. Mr. Indimuli, resources are not from the Ministry of Health. They are appropriated by Parliament. So let the parliamentarians say how much money they will give so that this institute can function properly. Thank you, Dr. Jem Nyiskal, who is also the chair of the committee, Departmental Committee of Health at the National Assembly.
Thank you. The Cabinet Secretary in the Ministry of Health, Honorable Aden Duale, PS in the State Department for Medical Services, PS in the State Department for Environment, the Director General, the CEO of the Council of Governors, the Chair of the Board of our new baby NPHI, and the board members that are here, our partners who are here with us, WHO, Africa CDC, USA CDC, the Secretary of SCAC, all the distinguished guests that are here with us. Good morning. CS, let me start by welcoming you to the sector. This is our first function together, and we were with you in Parliament, I think, for 2 terms, and you are the leader of majority and therefore functionally the leader of government business in the House. And yes, I think that actually has given you a lot of experience in interconnectedness and the interrelatedness of the whole government structure. None works on its own. And perhaps this explains why you have been able to move very easily from one department to another, because you saw them at that time. Welcome. Health is everything. Human beings wake up in the morning for one purpose only, even if they don't know. It's about their health. They call it welfare. But you can have no welfare if you do not have health. A failure of any system of governance or structure becomes a health emergency. If there are riots in town, if there is a civil strife, the health sector takes the biggest burden, CS, even if you are not involved in the process. If there is a drought, it's the health sector that eventually takes the burden. If agriculture fails, if there is fire, if a building collapses, if a car crashes, a plane crashes, what are people asking? How many people are there? How many are injured? How many have died? And how are they being taken care of? So all of us, if you think about it carefully, we are concerned about our health so that we enjoy any other welfare that a human being enjoys. So health is critical. But if you come now to management of the health sector, it's a very expensive affair. And the best one would do would be to actually prevent so that people don't get sick, so that they even forget your ministry. You know, if people are not sick, they'll not know your ministry. And that role is the role of public health. Public health prevents people from being sick. It promotes health. It looks at epidemics. It looks at pandemics, how diseases move, disease surveillance. If all those are working functionally well, then sickness that people seem to think is the main thing of health is actually prevented. And therefore, CS, if you're today launching the National Public Health Institute, you are launching probably the most important structure in the health system. But you will also realize that emergencies that are prevented are never realized. And therefore, if you prevent an emergency, you may not even attract the press. Let me give you an example. If a bus full of people is hurtling down the road and the bridge around the corner was washed away, and somebody waves madly and stops the bus, and the bus doesn't plunge into the river, it will not appear in anybody's press. But if the bus gets to the river and plunges and people die, the people who remove the dead people and try to help them will get a lot of press attention and praise. So it is with public health. And therefore, as you launch it,